So as I'm sure that you know, you have to be able to register with the HCPC to work as a biomedical scientist in the UK. And to be able to register, you need to have completed both an IBMS accredited degree programme, BSc programme, or have done a non-accredited degree, but have some supplementary education identified by the Institute. It's called top-up modules. So there needs to be a degree qualification, which is appropriate, and also complete the IBMS registration training portfolio. So you need to have both of those bits in place in order to register as a biomedical scientist in the UK. Once you have the appropriate degree qualification and the right subject content, and you've passed the registration training portfolio verification, the Institute can issue the certificate of competence, and it's that that's required for your registration with the HCPC. So the reason that we have both of those bits of the jigsaw for the registration is we need to ensure that candidates meet both the HCPC standards of education and training and the HCPC standards of proficiency. So the way that we do that is the degree programme covers the standards of education and training and the right curriculum content, and the portfolio covers the standards of proficiency. So we need to cover both the sets and the SOPs in order for someone to have the right knowledge and understanding and competency in the laboratory to enable them to register as a biomedical scientist. Once both of those things are in place, the Institute can issue the certificate of competence to that particular candidate, and then the candidate, once they've received the certificate of competence, can register with the HCPC as a biomedical scientist. So the version of the portfolio that you'll be really familiar with will be version 4. So the latest version was 4.3. That's probably the one that if you have any colleagues working through, will be working through at the moment. The version 4 IBMS registration training portfolio was based on the standards of proficiency from 2014. So they were quite a long time ago. It's been quite a while before they've been updated again. So from 2014, version 4 has been the version of the portfolio that you will have had colleagues working through. In the version 4 portfolio, there are 105 standards of proficiency. So there are 105 standards that are spread across the portfolio in section 1 and section 2. Each of the sections has 5 modules, and across those modules, the evidence is presented as 30 separate pieces of evidence. So colleagues who are doing the portfolio at the moment, version 4, will present 30 pieces of evidence, 3 for each of those 10 modules, and they will demonstrate how they are meeting the standards of proficiency from 2014. So as I've said, the portfolio is organised into 2 sections, 5 modules in each, which breaks down to be 3 pieces of evidence per module, which should map to the standards of proficiency within that module of the portfolio. So hopefully this is something that you're familiar with if you're working through, if you're training or mentoring colleagues in the laboratory to do the registration training portfolio. And what we've agreed with the Healthcare Professions, HCPC, Health and Care Professions Council, I was going to say standard, was that we would issue the version 4 training portfolio up to and including the 31st of August this year. And then after that, because their new standards come into effect from the 1st of September this year, that we would switch to a new version of the portfolio that was mapped to the new standards. So if you applied for a registration training portfolio up to the end of August, you will have been issued with version 4.3. If you applied for a portfolio on the 1st or after the 1st of September, you will receive a version 5 registration training portfolio. So both versions of the portfolio, as I've said, are mapped to the HCPC standards of proficiency for biomedical scientists. That's what the portfolio is used to demonstrate, that you can evidence that you are working at the right level to evidence that you are working to the standards of proficiency appropriately. So that means any changes in the standards of proficiency will mean that we have to update the registration training portfolio because the 2 things are mapped together. So any changes to the SOPs mean that we need to change the registration training portfolio as well. What happened when the HCPC did their update was that they changed the number of standards of proficiency from 105 in 2014 to 129 in 2022. So that means that those extra standards we need to be able to map to the portfolio structure, put them in places that are logical and include them so that they can be evidenced against in the new portfolio. So I've put a link at the bottom of this slide. If you go to the HCPC's website, they have a really clear PDF that says what the new standards are and also compare the old and the new standards. They're really easy to find, and we also have them at the Institute. So if you want to get those documents, you can ask for them, or they're up on the web page for you under registration training portfolio. So it's easy to see what the differences are between the old and the new standards. So as I've said, up to the end of August, we've issued everybody who applied with a version 4.3 registration training portfolio as normal. From the 1st of September, we've collated all the applications that have come in, and those candidates will be issued with a version 5 registration training portfolio, which will be a digital portfolio, and that will be hosted on Onefile, which Jim will talk about in the next session. What we've agreed with the HCPC is that all candidates, irrespective of whether it's version 4.3 or version 5 of the registration training portfolio, will be asked some questions at the point of verification about the newly introduced standards of proficiency. So to bridge the gap while people are finishing the version 4.3, we will make sure at the point of assessment that they are asked questions about the areas that have been expanded and enhanced in the new standards, which came into effect from the 1st of September this year. So all verifiers who are on our list as IBMS verifiers and all of the candidates who are waiting to be verified for version 4.3 have been sent some information about the areas that they will be asked about during the lab tour to make sure that they do understand what's changed between the 2014 standards and the 2022 standards. So all of that information will be given to you. If you've got people who you work with who are finishing their portfolio soon, tell them not to worry. We've got the areas mapped out for them. We'll send that information through, and they'll be expected to answer some questions about what's changed, what do they know about those areas, and how can they demonstrate them in their practice to make sure that people who are finishing 4.3 and people who are doing version 5 of the portfolio have the same ability to map to the new standards. So as I said, the new standards were actually released last year in 2022. That's when the update happened for the standards of proficiency. But the HCPC's date for implementation is the 1st of September 2023. So we've rewritten the portfolio, we've mapped to the updated version of the standards of proficiency, and we've called the new version of the portfolio version 5. Because we were doing the updates to the new standards anyway, we've taken the opportunity to create a digital-only portfolio as part of the update. The reason we've done that is it's quicker, it should be more efficient, and it should streamline the process. So the version that we've gone for on Onefile is easy to use. It's very intuitive, it's not too techy for people to get the hang of, and it means a lot of the administration for the process will be taken care of within the system, which will make it much easier for the education officers at the Institute and also for training officers, candidates and verifiers. So let's have a look at the new standards of proficiency and what's changed between the old wording and the new wording. The key thing to understand about the new standards of proficiency is that the wording has changed from knowing about something to actively demonstrating it in your practice. So the wording in the new standards is all about you need to demonstrate that you do this. You need to show how you do this in your practice. You need to show us that you are demonstrating that you live and breathe these standards of proficiency, not that you know about them or have understood them. So it's a shift in the wording. So it's much more about knowing and using rather than just a passive understanding that you know what the SOPs are. So some of the areas that have expanded, the importance of maintaining fitness to practice has been expanded to include mental health as well as physical health. So you'll see in the new standards of proficiency that there's more on people's own mental health, understanding if they're stressed or anxious and how they need to seek advice if it's necessary and support if it's necessary. So that's been expanded in the wording for the new standards. It wasn't there before, but it is now in 2022. There's much more in equality, diversity and inclusion, and that's the HCPC's wording. So we use equity rather than equality, but the HCPC use equality, diversity and inclusion, or EDI. Previously, there were 3 standards of proficiency that were on EDI. There are now 15. So it's one of the bigger areas in the portfolio. There's much more in there about, again, demonstrating in your behaviours how you model understanding of equality, diversity and inclusion. If you see barriers to inclusion, what do you do about them? Do you understand that you need to maybe work with people differently depending on who they are and what you're doing with them? So there's much more about being aware of EDI, but implementing it in your behaviours and in your practice. The central role of the service user is obviously still there in the standards of proficiency. It's expanded in informed consent and effective communication with service users. And the HCPC's point of view is very much the service user as the patient, not just the service user as somebody else in pathology services or maybe other people external to the lab that you might interact with. So we understand that that might be difficult for some people, especially if they're a trainee level apprentice or student on placement. But we're hoping that with the point of care testing that's evolved solving in practice, it's going to be easier for them to shadow or to work with others so that they can demonstrate some patient interaction, and they can model what they would do under those circumstances to demonstrate how they would interact with different service users. The need to keep up to date with digital skills and new technologies is an obvious one. There's just more on it in the new standards. So that might be digital skills with respect to your own CPD. It might be to do with the technologies that you use in your laboratory. It might be to do with understanding how information is brought into the lab and goes from the lab. So there's lots of different ways that you can evidence how you're keeping up to date with your digital skills and also with technologies relevant to practice and also to your own CPD. The role and importance of leadership is another area that's been introduced in the new standards of proficiency. So again, this is relevant to the level of the person who is completing the portfolio, or if you're evidencing your own CPD, it's relevant to the role that you hold when you are in practice. It's about understanding what good leadership looks like, the skills and attributes that somebody would have if they are a good leader, and understanding how leadership works at all different levels of practice. So again, if it's a trainee, an apprentice or a placement student, they won't be leading the laboratory, they won't be leading any of the processes, but you could be thinking about how they might show that they have leadership of a particular thing that you ask them to do. So it could be a quality audit, or it could be a sample audit, or it could be a particular bit of training where you ask them to coordinate a group of other trainees or placement students. So thinking about ways they can demonstrate their own leadership skills, but also identify good leadership skills or do a gap analysis appropriate to the level of work that they do in their practice. And then there are also more on the promoting public health and preventing ill health standards. So again, they've been expanded slightly, talking about public health and preventing ill health in others, as well as in the registrants as well. So those are the areas that have been updated and expanded. As I said, there's a PDF document that explains all of the standards and compares the old and the new. So you can have a look at those and really get your head around what the differences have been that have been introduced. So to create the new version 5 registration training portfolio, just to reassure you, I didn't sit in a dark room and just decide what to do on my own. We had a working group of colleagues from around the UK, from all of the devolved nations and across England. And I worked with a working group to look at our current portfolio and to look at the new standards of proficiency to work out what was the best thing to do and how to tackle creating the new version 5 portfolio. We looked at the existing sections and modules, and we looked at the standards, and we tried to work out whether we could keep the majority of the structure of the portfolio to be the same. You'll be delighted to know that we can keep most of the structure the same. And what we did was keep the sections and the modules the same and make a few minor modifications to the title of the modules. And what we did was to map the new standards of proficiency that have been introduced to the relevant modules, put them in sensible places and group them together as we always have done. So when you look at the new version 5 portfolio, it should look pretty much familiar to you. It's just some differences of where standards are. The standard numbering has obviously changed because there have been more of them this time. So the numbers of the standards will change, but hopefully a lot of the module standards will look familiar to you from the previous version of the portfolio. And to help people to get ready for September to update training plans, we released a simple mapping document in May this year that showed where the new standards were within each section and module of the version 5 portfolio. This PDF again is under useful resources on the IBMS website, and it's also under education with the registration training portfolio documents if you want to have a look at it there. So it's just a diagram that has dots for each of the standards of proficiency and where they sit in the portfolio. So these are the headlines for what's changed as far as module titles are concerned. So in section 1, all of the module titles have remained the same with the exception of module 2. Module 2 used to be equality and diversity, and that's been expanded to include those new standards of proficiency on EDI. So we've called the module equality, diversity and inclusion to mirror the HCPC wording. The same in section 2, the only module that has changed is module 2. That used to be health and safety, very much focused on health and safety in the laboratory, COSH, risk assessments, understanding how to work in practice. And we've added in all of those new standards of proficiency on well-being, so that people have now got the module health and safety and well-being, because we thought that those two things went together well. So physical safety in the laboratory, mental health and well-being included in the same module. But all the other module titles for section 2 again remain as they were before. So we went about mapping the new standards of proficiency to the registration training portfolio to create version 5. We kept the existing module structure as consistent as we could so that people would be familiar with it. But what we did was look at the standards of proficiency and we balanced them better across the modules. So previously, as I've said, the EDI module only had 3 standards of proficiency and others had 20, 25. So we took the opportunity to rebalance the standards of proficiency, not exactly the total number, but what we thought would be required to evidence them appropriately and to demonstrate that people are working at that level and can demonstrate in their practice how they can evidence the standards of proficiency. We also looked at the pieces of evidence and we agreed that we thought 30 pieces of evidence across the portfolio was right and that we weren't going to increase the number of pieces of evidence or decrease them. So we said that the pieces of evidence will stay at 30. That's 3 pieces per module. But we also agreed that every module must have all of the standards proficiency within it mapped to the pieces of evidence presented. So we haven't changed that, we've just clarified the wording. So the wording used to be that you needed to evidence the standards of proficiency, but it didn't all have to be in the portfolio. But then when the verifiers come to assess the portfolio, it says, have all the standards been met in the portfolio? So it was a little bit of a grey area. So we've taken the opportunity to just make that much clearer and to say the standards of proficiency that are listed in the module must be covered by the 3 pieces of evidence that are being put forward by the candidate and the training officer for that module. The reason we've made that much clearer is because that's what the HCPC say. So the HCPC say the standards of proficiency are the threshold or entry level of the standards they consider necessary to protect the public. So if you are training a candidate to be ready to become a registrant, they need to demonstrate that they meet all of the standards of proficiency. So we've made that clearer, and on the Onefile system, it is set up to know which of the standards of proficiency are in which module and to evidence that you are mapping against them. If you miss one by accident, it will know and it will tell you. So we've made it much, much clearer in the wording that we expect all of the standards of proficiency to be mapped to each of the pieces of evidence within each of the modules. So that means at the point of registration, all of the candidates will be able to demonstrate they meet all of the standards of proficiency for biomedical scientists at the point of registration with the HCPC and that they are safe to practice. So then people say, that's fine, but how am I going to do that? You're asking me to evidence a lot of standards of proficiency with 3 pieces of evidence. So how am I going to manage to do that without them becoming enormous? So what we are asking you to do is to talk to the candidate, and you as the trainer or mentor will select the pieces of evidence that you think best fit for the module and will cover several standards of proficiency at once. I know lots of people are doing this anyway. Lots of people I talk to in the laboratories say that the reason that we choose a piece of evidence is it can hit 4 or 5 standards of proficiency at once. When we were looking at the modules and we were looking at the types of evidence that we were expecting, we also had in mind that the standards of proficiency are quite generic. So it means that lots of different types of evidence are acceptable. You don't have to just use written pieces of work. And I'll go on to talk about other types of evidence and what you might consider using in the next few slides. But the generic nature of them mean that you can use lots of different types of evidence. And we do like a good variety of evidence in the portfolio as well. Onefile is set up to accept lots of different file types. They don't just have to be Word or PDF documents. So that gives you a little bit more flexibility in creativity and also being able to upload different types of evidence as well. As we've always said, the best evidence will demonstrate the candidate's knowledge and understanding, but also how they apply it to their practice. It needs to be laboratory-based, practice-based, and be evidenced in their behaviours. So it's not that knowledge and understanding piece on its own. It's about how are they doing that? How are they living and breathing those standards in what they do in the laboratory environment? So for the new portfolio, we've kept the 30 pieces of evidence, as I said a few times, so that hasn't changed, 3 pieces per module. Previously, there was 1 compulsory or mandatory piece of evidence, which was in section 1, module 5 for professional relationships, and that was the reflective statement. So in the version 4.3 portfolio, we said that that had to be the piece of evidence for that particular piece, for 1 piece of evidence in that module. What we've done with the new portfolio is introduce a mandatory piece of evidence for each one of the modules. And again, the reason we've done that is to be helpful and to be supportive. So when we've talked to lots of people who are doing training all the time, We talked to the practice educators across England. We talked to colleagues in all the devolved nations. We talked to people who are new to training. And they've all said either we already have pan pathology training plans. So we have a training plan that works whether you're in microhematology, cell path, or genetics, or whether you're in one of the other disciplines. So we already use some standard pieces of evidence for all of our trainees because we find it easier, but they can make it bespoke to where they are. Or if people are new to training, they say, I look at the training plan, it doesn't make a lot of sense to me. I don't really know what I'm supposed to be doing for the pieces of evidence. So we created mandatory pieces of evidence for each one of the modules across the portfolio as evidence one. So that will be the piece of evidence that we ask you to do to help to scaffold training, improve consistency with the evidence that's put forward across the UK, wherever that person is doing their training, we know that they're being trained to do the similar tasks. The flexibility and the innovative context for evidence 2 and 3 is exactly as it always was. So we don't want to stifle creativity and we don't want to mandate everything that goes into the portfolio, but we thought it was important to have a structure or a scaffold around the training plans, and then evidence 2 and 3 is a flexible choice for you and the candidate to put forwards. So the details of the mandatory pieces of evidence were released in July, and there's a frequently asked questions document. Again, they're both with the registration training portfolio information on the IBMS webpage. If you go to education, go to the registration training portfolio, they're all at the bottom of that page if you scroll down to the bottom. So all of the mandatory pieces of evidence are well described. It tells you what you can do, and evidence 2 and 3 you can still choose. There's more information on the mandatory pieces of evidence and also about the evidence 2 and 3 in the guidance documents that we've produced as well. So previously there was one guidance document for everybody, and what we've done is split it into a document for the candidate, for the trainer, and for the verifier for the version 5 portfolio. The reason we've done that is a lot of the information is similar, but there's bespoke information for each of those audiences, so we split them out. What you'll find in the guidance documents, and we've also put this up on the webpage as a separate document as well, is the content of the modules, the module learning outcomes that we expect people to meet, and examples of evidence, along with some frequently asked questions as well within the guidance. So in each of the guidance documents, Appendix 2 will explain exactly what the mandatory piece of evidence is per module, and Appendix 3 will contain examples of other evidence types for each of the modules as well for evidence 2 and 3. So you can have a look at that, you can see what the mandatory piece of evidence is, look at the context of your laboratory and the kind of tasks that you will ask the candidate to do, and you can use that piece of mandatory evidence. We've already mapped it for you to the standards of proficiency. And that means evidence 2 and 3 for each module will then map to the other standards of proficiency. So we've done quite a lot of that work for you and given you examples of evidence types you might want to choose. It's not an exhaustive list. If there are other things that you would like to choose, by all means do that. And one of the sessions that I'm going to do later in this morning's session is to talk about evidence types and things that you already do, things that you could share good practice with others while we're doing the training session today. Last thing to say before I hand over to Jim, we're going digital with version 5 of the registration training portfolio, as I'm sure you know. That means we don't have a PDF version of it to send out. So we had a reference copy of version 4.3 on the web page. We've taken that down because we've transitioned now to version 5. It is hosted just on Onefile. So there isn't a version of it we can show you, but you don't need to see it. Everything you need to know is in the guidance documentation. It tells you about the modules, it tells you about what the candidates could do, it tells you about the evidence types you need to put forward. So you don't need to see the portfolio until you're gathering evidence and it's been uploaded onto the system. As I've said, we're using Onefile. That's what Jim is going to talk to you about next, because it's an established platform and we think it works well for the portfolio. And this will cover all of the routes to registration. So the registration training portfolio for people who are in employment having done a degree, people who are doing sandwich placements, and people who are doing an integrated degree program. So that could be applied biomedical science or it could be an apprenticeship. So the registration training portfolios for anybody who is doing it is now on Onefile as a digital version, version 5. We know that changing it from version 4 to version 5 is a big change. We understand that. We know that it's different for people and their training plans are going to need to change, and the way that you're thinking about getting candidates ready, preparing them and training them is different. So what we're looking at doing is making incremental changes over time as we transition to Onefile. So we're going to keep some things the same in the short term and change some things incrementally as we go forwards. So at the moment, if you want to apply for a portfolio for a candidate in your laboratory or a placement student, it's exactly the same process as it was before. The application form is on the web page. You will fill in the application form and send that to registration@ibms.org, as you always have done. You'll need to include in the application form the candidate's name and email address, and you'll also need to fill in the training officer's name and email address, again, as you've always done before. On Onefile, we can set it up so that people have different permissions. So if there's anyone else that you would like to be able to see the portfolio, sign off evidence, or just look at progress and see how the candidate is doing, you'll need to tell us who that is and what role they're going to have. And then we can, again, add them onto Onefile. All the laboratory details, information about the lab, where you are, what the person is doing, all of that is still exactly the same. So applying for the portfolio will be the same. The portfolio itself is hosted on Onefile. And that is it. Thank you very much. Hopefully that did take half an hour because we started a little bit late. So I'll stop sharing my screen and I'll come back into Teams, and you can let me know if there's been any questions or queries or anything you'd like me to pick up.
Few questions to get started, so.
Right, so I have stopped sharing. So Antoinette's got a hand up. Do you want to go, Antoinette?
Yeah, I just wanted to ask, so you've mentioned about at the point of application saying who needs to be able to access Onefile. What if that changes during the course of, you know, because it's a long time, the portfolio, and staff leave, staff change roles. So how easy is it to change people's access?
It will be easy. So I can see Jim nodding as well. So at the moment, what we're going to ask is that you let the registration team know. So you would let my team know of education officers. So you would just send in an email and say, this person was the training officer, they've now moved, it's this person instead, here's their contact details. Or you would say the person, I mean, whatever the change is, you would just list it. Eventually, in the fullness of time, we could have that you could make those changes yourself on Onefile, but we think better to do it incrementally and stepwise. So initially you would just send an email through and say, there's been a change, the people who are training this candidate have changed, could you update the details? And my team will do that. As we go forwards, it could be that's part of the self-service on Onefile, that if it's a small change like that, you can just edit it yourself. So is that okay, Antoinette? Yeah.
No, that's perfect, thank you.
Let me just have a look. I've got the chat on, but I'm going to look at the who's got their hand up instead. So Sarah, I think, is next. Sarah Addison.
So I've got a candidate who's currently doing version 4.3. We've got the version 5 that's come out. Is there a deadline now on them needing to complete version 4.3?
So this deadline is the same as it always has been, Sarah. So the candidate has 3 years in which to complete. Most people do it well within that, but that hasn't changed. So it's 3 years from the date it was issued. It should be they'll do it quicker than that, but that will be a deadline where that's a hard deadline. They need to have finished it by then. So same rules as before.
Okay, great. Thank you.
No problem. Yvette, I think, is next.
Hello.
Hi, Yvette.
Just a quick question. The evidence that's compulsory now in 4.3, reflective statement.
Yeah.
I noticed when I've come to rewrite my training programme that in version 5, the wording has gone back to what was previously required in the version before 4.3.
In what way, Yvette?
It makes it a little less detailed.
So what we've tried to do with the description for the mandatory piece is make it broader so that people can tailor it to their environment. So what we've tried to do with each mandatory piece is not be too directive. So in your laboratory, the reflective statement might need to be in a certain format, or that candidate will do certain things. So we tried to broaden it back out a little bit rather than making it specific. But what it does do is map to the standards of proficiency. So you'll see listed the new standards of proficiency numbers, but actually it's the same requirement that you still need to hit those standards. But we tried not to be too prescriptive about exactly what goes into it, because we're aware that people have different contexts in which they're working.
Yeah, I kind of understand that, but I thought to me, it looked like something. I haven't got the wording in front of me, unfortunately, but the wording of the requirement of the reflective statement looked like it had gone backwards a little bit.
I think it's, if you have reflective statements that you're doing with your candidates for 4.3 that you think fit and will meet the standards of proficiency and you prefer to use them, then keep them. That's absolutely fine. If you think that the version 4.3 wording was clearer and you find it easier to tell your trainees what you want them to do, then you can keep doing that as long as it hits the new standards. That's absolutely fine.
Yeah, I think my concern was that it was the compulsory piece of evidence.
Yeah. It is still the same one. It may be that the standards that it's mapped to, their wording has changed slightly, which has been able to free it up a little bit, so it's not quite as prescriptive as it used to be.
Okay,
thanks, Yvette. Thank you. Tanya?
Can you hear me?
Yes,
yeah.
Tanya.
Thank you. Just two quick things. So I'm from NHS Blood and Transplant.
Mhm.
Nearly all of our interaction with the portfolio side of things is to do with donor blood samples. You've just said that now there's more of an emphasis on the service users being just a patient and not other people you work with. Our point of care testing, the only thing we've got is doing hemoglobin estimation with the donors at the session. So does that mean now that we won't be able to complete the portfolio?
No, not at all, Tanya. So I've had a few discussions with the HCPC and said there are some of the standards that we know our practitioners are going to find hard to evidence. And they've said it's context dependent. So the standards are generic across different professions. If you look at some of them, everybody who's on the register for whichever profession have to do them. I did point out to them that it could be quite difficult for some people to show that patient interaction. And what they said is it's context dependent. So if yours are donors and that's what people get to see and that's who they get to talk to, then you put that in as normal. There are some people who don't often see patients, but they can go to a clinic in the hospital if that's where they are. I understand in your context that's a bit more difficult. So what you've been doing previously and we've said is okay, continue to do that. But they did say they want the emphasis more on a patient, not just a colleague who works in a different lab or a doctor or somebody you're ringing to give results to.
Lovely, thank you.
Does that help?
Yeah, thank you. The other quick one was about it being on Onefile with no reference copy. Most of the people that complete the portfolio in the organisation are in labs. There's not really free computers. So having that reference copy is really useful to them, because if they're doing a piece of evidence, they've got a bit of paper that they can compare it to and map their evidence rather than having to fight to find a computer to log in to work it out.
That's fine, Tanya. So what they would need to go onto Onefile to do is to upload that evidence. Between the guidance document and that simple mapping document, they'll have all the information they need in the lab to know which standards of proficiency they're trying to hit. So if it works for you for them to do physical hard copy paper things in the lab, scribble on them, whatever, they can have those reference copies of the guidance documents with them so they know that they're doing the right thing, and they would only need to upload it onto the system later. If you have loads of computers around and you can do it at work, great. But if you don't, you can still do it the other way.
Okay, lovely. Thank you.
No problem. Rebecca?
We got acknowledgement from the IBMS of a student on the version 5 of the portfolio last week. Just wondering what the time frame is when we'll actually get access to Onefile.
I'll let Jim answer that. So the thing is, Rebecca, we said at Congress we were hoping it would be the end of last week, but the team are really busy. And I said to them last week, I'd rather it's done right than done quickly. So just to reassure you, you can start collecting evidence before you get to see Onefile, before you can physically see it. But Jim, do you want to just say where you're up to with the education team?
Yeah. Thanks, Sue. So as we said at Congress, we were hoping that it would start last week. With a combination of sickness and the new system and that kind of thing, it's taken us slightly longer than anticipated. One of the things I'm going to update as I go through Onefile today is the fact that as soon as this training for trainers session is finished, I've got a catch-up meeting to just check that the team are happy to start today. So it is in process, it's happening. The applications that you've submitted have started to go onto Onefile. With it being a new system for them, they're just a little bit nervous about clicking the button to actually press go. So they just wanted me to check through things before it actually comes out to you. So it should be today, tomorrow, Wednesday as they just start going through and clicking the button now.
Okay, thank you.
Yeah.
Thanks, Rebecca.
It's sod's law that it's, we've come straight back from Congress and there's this period of sickness and various other things that have come in. So yeah.
Yeah, we know what we need to do. We're just working out behind the scenes, aren't we, to do batch uploads and how it works best for the team. So please don't worry if you're not on it yet. You will be very soon. Is it Olakemi?
It is, yes. Hi. Morning. I've got 3 questions. I'll probably just ask all 3 at once.
Okay, I'll try and remember them all.
The very first one is you mentioned about the new version accessing it on Onefile, and we have to mention who needs access to be able to sign things off. So in situations where we've got candidates rotating around the department and you have various seniors or colleagues signing various pieces of evidences, do we then need to ask for their access as well to sign that off on Onefile, or can the training officer just do that? How does that work?
The answer is it depends. So if it works better for you that, again, they have a physical thing with them, somebody physically signs that off and then it gets uploaded, and then you as a training officer would say, I've looked at it, I've checked the signature, everything's fine, you can do it that way. If it works better for you that anybody that interacts with them can be on Onefile and do it digitally, you can absolutely do it that way. There's no maximum number, is the Jim, of the people who can be attached to one person. So if it works better for you, and the system will remember, so if you have people who are involved in everybody's training, so they might be in haematology or cell path or micro, but it's the same group of people, if you let us know who they are, we can just make sure we add them for each of your candidates.
Okay, thank you. Okay, so my second question is, because I'll be doing a verification in a couple of days. In the email that I got, they put it there that we need to ask about the new standards. How strict, well, if that's the word to use, can we be for the candidates if they're not able to give the answers that we require, being that it's new? I know the training officers should have put them through, prior to having that verification, but what then do we do if the candidate isn't able to answer any of those questions? I
think that's a really good question. I think what I would do in that circumstance, if they really don't know anything at all, they haven't done any prep, they really don't understand it at all, then you could say, well, I can't give you the you can't say yes, it's not a pass today. You're going to have some work to do. You can either send me something or we'll have another conversation, because they do need to meet those standards to get a pass. So if they've got some knowledge and you probe them a little bit and they can answer the question and you think, yeah, actually they're about there, fine. If it's an absolute blank, they don't know anything at all, they don't know which areas have expanded, they don't know anything about them at all, I think you would need to pause at that point and say, I think you've got a bit more work to do. Here are the changes, you go and have a look at them, we'll have another conversation, and at that point then it would be a pass.
Okay, and my very last question is, I know recently the IBMS has put a cap on qualifications past 10-year period.
Yes.
And ideally, whenever people have evidences within, I think it's section 2, module 5, where you can put your qualification as
professional knowledge.
Yeah. But well, again, I've had people that have put old qualifications in there, and I know that's not within 3 years. We're not allowed to accept that. But if the IBMS is taking qualifications up to 10 years, is it what us, well, not us, but IBMS taking that sort of evidence on board, or you still want it to be within 3 years?
Okay, so they're two different, that's a really good question, because they're two different deadlines. So the 10-year is for someone who's done a non-accredited degree, for us to consider the knowledge to be current enough to accept that qualification and to assess it. The 3 years is the portfolio deadline. So any evidence within the portfolio has to be within the past 3 years. What I would say as far as previous qualifications are concerned, the candidate shouldn't just put a degree transcript in, or they shouldn't put in their research project, which is something they like to do. They should talk about what they learned during that qualification and how that is impacting on their practice, how they are using that now. That's what they should be doing. So even if they did the qualification a few years ago, they could reflect on what did they learn academically that they then implemented in the laboratory and use in their practice, and that would bring it within the 3-year period if it was a bit older.
Okay, so just to clarify that again one more time. So if I have a candidate that's probably finished uni, let's say 2017, if they were to reflect on their practice based on when they finished to what they're doing now, that should be good enough to use?
Yeah, so it should be, this is what I learned at the time, this is what I've done in between, this is how I've enhanced, improved, whatever, and this is how I'm using it in my practice, and that will be fine because that's current then.
Thank you very much for helping.
No problem. Tracy is next.
Hi, so I'm really brand new to this. I've literally been a training manager now for nearly a month. So
welcome, Tracy. You're amongst friends.
Thank you. I've got considerable experience as a senior BMS, but I've changed over into completely different discipline and everything. So finding my way through. As I've become a training manager, so I'm managing one huge department with several different training officers, all under blood sciences. So there's haematology, biochemistry, specimen reception, and a tiny bit point of care.
Yeah.
All doing various different portfolios. So I'm trying to pull them all together so that they're all doing something similar.
Yeah.
But some of them don't actually know when they started their portfolio. How would they find that piece of information out? What
We can find that for you, Tracy. So we know when they've been issued. So
Yeah.
if you could send an email address to registration@ibms.org, list the person's name, and they should have a unique identifying number.
Yeah.
So when we issue the portfolio, we say use this whenever you communicate with us. If you could send an email that says this is the candidate's name, this is their unique number, could you let me know when they were issued the portfolio? We'll have that information on the database. It's not a problem.
Perfect, because I've had a meeting with them all, and I'm like, when did you start? And they're like, I don't know.
I don't know.
I'm like, excellent, great. And for those that have taken more than 3 years and they're not particularly very far through with it, would it be easier for them to just stop and start on the new version, or see it through?
If it's older than 3 years, they would need to update their evidence anyway. So
Yes.
it might be something you might need to do on a case-by-case basis.
Yeah.
So it may be that somebody has maybe been on maternity leave and, that's the reason they've not got on with
No,
it. It may be
definitely.
that they've not had support. So I think if you look at them on a case-by-case basis, if they don't have much to do, and they could finish 4.3 in a reasonably quick time, they're going to have to update any old evidence. So that's going to have to be done anyway. It's
got
probably
one
worth
in
a
each
conversation sorry. Go on.
I've got one in each position, one that's very nearly
Right,
done, and
right.
one that doesn't think they've done particularly very much and thinks they
Okay.
may have to start again.
Okay, so I would say for the one that's nearly done, it would be for you or for their training officer to go through with them the old evidence and bring that up to date. So that could be a reflection on it, it could be replacing it. So have a look at how much work that would be in addition to the new evidence they haven't generated yet. But if they're almost there, that sounds like the best decision for them. When they're verified, they will need to be talking about current things they've done, not referring back to something they did ages ago. And then for the other person, it does sound like maybe starting again might be the best thing to do, now that you're at the helm.
Yeah. So would I just apply for the version 5 for them?
Absolutely, yeah. So if you let the team know, because they will already have one, so it might be worth it when you send that email to the team to say this particular person is going to stop the version 4.3, will apply and pay for a new version 5. Could you make a note of that on the system, and then we know exactly where we are.
Perfect. Thank you very much.
No problem. Durga?
Perfect.
No problem. Are you there, Durga? I think you're next. I think you might be on mute, Durga. Oh, there you go. Are you talking? You're unmuted, Durga, but I can't hear you. It's not coming through. Do you want to pop your question in the chat if it's not coming through, Durga? Do you want to pop that in the chat, and I'll move on to Fiona, and then Fiona can ask her question. Okay, Fiona, do you want to go?
Hi, I actually have a question regarding the 4.3 and version 5, I suppose, as well. Do you have a minimum length of time that you expect the portfolio to be completed in? I know you have a maximum of 3 years, but is there a minimum time?
Not really. We've not said a minimum, because for me it's about experience they have. So they could rattle through and produce 30 pieces of evidence quite quickly, but do they have the knowledge and experience and the breadth to be able to be left on their own? That's really what we're signing them off to do, isn't it? To say they're competent to practice and they can be left to their own devices and do things by themselves. So I would say the reason we don't state a minimum is everybody is different. The quickest people get through is 6 to 9 months normally. They don't normally do it faster than that. So if you've got people pushing, saying I want to do it in 5 weeks, they are not going to get it done in that kind of time. So if you ask them to be realistic about what you are signing them off to do, and that they, you are saying that person is competent to be left by themselves and to do things unsupervised, then that might just get them to reassess.
Right, it's just we have somebody who's been an MLA for quite a number of years, so they are a little bit, more competent, I would say, than somebody just starting off. So it would be okay then to put them. We don't have to wait for a year or anything like that. We can just put them if we feel that they're ready.
Absolutely. So if you think 6 to 9 months is enough and they're getting enough rotation out of specimen reception to show that they're doing the biomed things, then if they can do it in 6 months, then that's absolutely fine.
Right. Okay. Thanks very much. Thank
you.
No
problem. Nazia?
Morning.
Hi, Nazia.
Hello. I was just looking through the new standards, and so there are 129 new standards, and they are reproduced as either a knowledge or a competence. And I noticed standard 5.4 has been reproduced twice, once as a knowledge standard for EDI and once as a competence standard for patient records and data handling. Is that
has. You get the gold star, Nadia, for seeing it before we managed to swap it. So yes, as we were going through, we've put it in the right place. So as we were going through the system, we have a colleague who's putting all of the standards onto Onefile, and we did reproduce it by accident. It should be in module 4, not EDI. It's now come off. So all of the guidance documents and all of the other things have been updated. So if you did download them, if you could go back on the webpage and just download them again, 5.4 was errantly put in module 2 and it shouldn't be in module 2.
So it's about reasonable adjustments. So that still
No,
fits
it
in
is EDI. It is an EDI one. Yes.
Oh, sorry, I said it the wrong way round.
It should be in module 2.
It should be 2 and not 4. Sorry.
2. Yes.
Misremembered
so is it
it.
a knowledge or a competence standard in EDI? Do we know?
I can't remember whether it was knowledge or competence, but remember for this, they're meant to be demonstrating how they do it in their practice anyway. So whether it's knowledge or competence, it should be, I know about it and this is how I do it.
So it's definitely just in EDI. Thank you.
It is in EDI. Sorry, Nazia. Misremembered.
The document has all been updated, and in Onefile it is correct. We've triple checked it now.
We thought of 129, we got one of them muddled up. We didn't think that was too bad.
No, that's really good. Thank you.
Thanks, Nazia.
Right.
Claire?
Sorry. Is it worth mentioning about the issue that I emailed you with recently about the degree assessment letters and everything got to be completed within a certain time?
It could be worth mentioning. Thank you, Claire. So on the current degree assessment, non-accredited degree assessment outcome letter, it says if there is a big change to the standards of proficiency, that you might have to go again. It should have said standards of education and training, and I've asked the team to update that. But if you have an old letter, so the degree is all about meeting the HCPC sets, not SOPs. So it should have said in the outcome letter standards of education and training. They haven't changed. The portfolio is where the standards of proficiency are being mapped to. So if you have a degree assessment letter and it says, if the standards of proficiency change, you're going to have to get in touch. Please don't worry about it. It's not the standards of proficiency. So this update that's coming from the 1st of September doesn't affect the person's degree assessment outcome letter. It should have said standards of education and training. I can see we've got 5 questions left. I'm going to take those. I'm conscious of time, Jim, because I know you've got to do your next presentation before we go to coffee. So we'll do the next 5 questions, but then we'll stop. You can ask us more questions later if you like. So Nuha, I think it is next.
Yes.
Morning.
Hi, good morning. So I'm not actually a training officer. I'm the lab manager here in SHMDS. I'm a biomedical scientist, but managing clinical scientists and STP trainees. The training manager, who's not in today, she hasn't got any experience training BMSs because we've never had a BMS trainee here. So what support do you are there any courses or support that I can get?
So we have a CEP certificate in expert practice in training, and people are signing up to do that at the moment. So you can have a look at that. That's really helpful for people who need training. We can put you in touch with other experienced trainers as well. So if you could drop me an email and say that you asked this question, could I put you in touch with some experienced trainers? I can certainly do that.
All right. Thank you so much. Thank you for that.
No problem at all. Next is Penny.
Hi, I was just going to ask about swap copies of the portfolio. Will they still be available?
For 4.3, yes. So within the period of time, so 3 years started ticking from the 31st of August. So if you say, I've lost it, damaged it, can't find it, something's happened to it, my dog ate it, then we can send you a new one out. That's fine.
So they'll get the same portfolio?
Whatever they're on, yes, they will get a different version. If it's on Onefile, they can't not get to it unless they can't get online. So if it's the 4.3, then we can issue a swap copy,
Okay.
No problem. And then next is it, Mithili?
Yes, hi there. Can you hear me?
Hi. Yes, can hear you fine.
So mine's following on from one of the questions someone else asked. Actually, I think it was Olukemi. So for 2.5, where for the research module we're talking about, you said give a reflection on their project. So and how they use it now, and what's changed or what's updated or future prospects, etc. But say if their original project was in a different discipline, and they're now doing their generic portfolio in a separate discipline completely. Can they then do something like, they can then go back and see if there's been any future developments in their project? And that's
absolutely that would be a really good thing to do. And also it's about the transferable skills. So doing a research project teaches you a lot about asking a question. What's the hypothesis? How did you show it? Did you do some statistical analysis? Was it reliable? So they can talk about that even if the the actual project material is not something that's as relevant to them now.
Yeah, that's good.
No
So I
problem.
have a verification on Wednesday, and I thought, oh my goodness, I was just about to have to go back to the candidate and ask her to change it completely. But it's all good. We're good.
No, that's all good. Yeah. Caroline, I think, is next.
I just wanted to check that currently we're not allowed to use one piece of evidence to cover, you know, 2 bits. You know, we're not allowed to cross-refer. Does that still stand?
Somebody asked me that at Congress, Caroline. It's a really good question. So what we said previously is if it's within one module, it should stay within that module, not be cross-referenced to somewhere else. What I'll say to you is Onefile has been set up to expect certain standards to be hit within the module, so the system won't expect you to cross-reference. Personally, I don't think it's a bad idea if within that piece of evidence they can say, I know it relates to that over there, because that's a much more holistic overview that candidate's got of the training that they've undertaken. So I don't mind that, but the system will expect it to be referenced to the standard of proficiency that's stated. So you can say, I've put it here in this module because I'm evidencing these standards, but also it links directly with something that I did over there. That will be absolutely fine.
Thank you.
No problem. Flynn?
Can you hear me?
Yes, can hear you, Flynn.
Oh, good, thank you. So I've literally just been a training mentor for 2 weeks now.
Congratulations, welcome.
Thank you. And I've got 2 people on the version 4, but I have no idea. I don't think they've got the Onefile access.
They won't for version 4. So version 4, they should have a PDF to work through, and they will stay on 4. So whatever they've started, if it was before the 1st of September, they will continue on that version until it's completed, as long as it's done within the next 3 years. So they should have everything that they need, paper-wise, to be able to carry on with version 4.
So with the verification and everything, is that putting everything into a zip file and email and stuff? Oh, same as when I did it then. Okay.
Exactly the same. So for version 4, what you'll do, I'll talk about this with evidence later, but what you'll do is the 30 pieces of evidence with the portfolio to the verifier at the point that you're ready for verification. Just make sure they're ready for those new updates and what's changed.
Awesome. Thank you.
Brilliant. Right, last question. Lucky last. Christina sneaked in. You got a quick question, Christina?
Hi.
Hi.
Yeah. Well, my question is because when I'm conducting the verification, I do come across some students, uni students, who come for placement. And due to our backlog now with the verification for registration, sometimes the evidence, which they provide is really good and excellent. But then when we are asking them the question during the lab tour, they do struggle with that because they're not coming back to the lab. And usually they have gone back to the uni for their final year. For these cases, is there any advice you would like to give us?
Yeah, that's a really good question, Christina. A lot of universities do that. The student does the placement year, goes back to the final year. Sometimes they don't do the verification till the end because they do the research project and add the evidence in. So it is a while since they've been in the lab. If you're finding that with particular trust that you're working with, or if it's a generic thing, if you could let us know, because what they should do is get them back and practice the walk around before you get there. That's what should be happening, so that they get to do a practice run before you go. So all of those if, buts, can't remembers are out of the way, and they know it and they nail it when you go.
Yeah, because now we are doing the virtual ones, and usually they already have those pictures and everything.
Okay.
But when you're asking even a simple health and safety questions,
it's
and they
like
can't
they
do struggle because they're like, oh, I'm aware of it, but I haven't gone back to the lab for this time period, you see. So that's where, but there are certain areas they are good, like when it comes to confidentiality. Okay, yes, this is what I do. They can show us the demonstration of it. So where sometimes I do struggle, like what we need to do, because it's a part of the verification that we are doing.
I will talk about it later when we talk about evidence. That should not be a PowerPoint presentation that they talk to you and that's it. You should be asking them questions. It should be interactive. If they can't answer the questions, then again, I would say it's not a pass today because I'm not sure that you know what you need to know. We need to have another discussion if you feel that strongly about it. If most of it is there and just an odd bit that you thought they could have answered that better, then that's probably okay. But it's your decision as the verifier. You're the experienced person doing the assessment. And if you don't think they know enough, you need to tell them they don't know enough.
And usually does the students, if let's say we are not happy with the way they have presented on that day, can the students go back to the lab? to again for their training or for a short practice in the lab for before the
You could recommend that. Yeah, you could recommend that. It depends on where they live, I guess, whether they've done the placement near home or near university, and whether that's still physically possible for them. But if you don't think they're at the right place, you shouldn't pass them.
Brilliant.
So if your advice is go back to the lab, then you should advise that. Okay, I'm going to move on. I can see another hand up, but I'm going to move on because I'm aware that we are now quite a little bit later than we said, but Jim's going to do his presentation in Onefile. Then we will have a comfort break and more caffeine and coffee, and then we'll start again with the information on evidence. So I'll mute and turn my camera off and just keep an eye on the chat while Jim's presenting if you want to go, Jim.
Lovely, thanks, Sue. So I'll just start by sharing the screen. So hopefully, as Sue's been talking, I'm going to pick up a few of the points that Sue made about changes to the portfolio and how that follows and feeds forward into the new Onefile based portfolio. I've also noticed as the conversation's been progressing, a few points have come up in the chat that I think it's possibly easy to just show you the answer on Onefile. So if you've raised a point in the chat that's not yet been addressed, apologies. I have been keeping an eye on it. And some of it I will just raise as we're talking now. So hopefully everybody can see the screen. And I shall crack on. So for those people who came to Congress 2 weeks ago now and saw some of the introduction to Onefile stuff that I presented there, certainly the first few slides will be very familiar to you, because I want to start today by setting the scene about how we've got to this point with Onefile. I'm acutely aware of the fact that we are running slightly behind time, so I will try and keep it as as quick as I can. But obviously, I'm very happy to answer any questions about the kind of back side of Onefile as the conversation progresses today. So the first thing I think to say is that the journey to getting Onefile ready to deliver has taken about 6 months now, and what we've done internally at the Institute is produce a roadmap basically of how we are going to listen to members' feedback, digitize the registration portfolio properly rather than in the quick way that it had to happen by virtue of the pandemic, but use all of that knowledge from the pandemic when we had to digitize everything quickly to kind of pick the best bits out and keep moving things forward. So we've already completed a scoping exercise where we looked at 9 different portfolio providers, and Onefile was by far the best portfolio provider that was out there. Can you hear me?
Yes, sorry, there's just a lot of people in the chat that can't see your presentation. Just thought I'd let you know.
Oh, okay, right, okay. So
I can see it fine, but I'll let you know.
Okay, thank you for stopping me. I can't see any of the chat at all, so I don't know what's going on. Sue, can you see any if there's a problem?
Yeah, a few people have mentioned that they can't see the slides again. So I've just said that I stopped sharing a while ago, and it should now be that your slides are on. I think most people can see them. There are about
so when this happened before, it did seem to be that once people left and came back in, it seemed to work.
Yeah.
So I don't know why it worked bizarrely, but
I'm not sure. Okay, there's a few people, there's probably about 20-30 people that can't see. If you put in the chat that you can't see, if you exit, come back in through the link, I'll let you back in and you should be able to see them again. So I'll get on with doing that if you carry on, Jim.
Yeah, I'll keep going, but I'll go slowly. I won't get into the nitty-gritty of Onefile until we get a bit more of a positive response on the PowerPoint. So yeah, Onefile was the standout winner. Of all of the platforms we evaluated, it was the one that allowed the greatest degree of to people on the ground actually delivering training and completing the training and amassing the evidence and collecting it all together. Once we'd done the scoping exercise, we were pretty much of the opinion that Onefile would be the best platform because effectively it becomes the digital ring binder that holds all of the evidence together. And that means that as training teams, if you've got candidates that are really digitally savvy and they want to do everything in the most modern, the most digital, the most technologically enabled way, Onefile will facilitate that. But if you've got a more traditional training structure where you still need to use written questions or paper-based material, Onefile is equally adept at handling that as well. So it provided the greatest degree of flexibility. Once we'd scoped the platform, we then went through a 6 to 8 week build phase where we transitioned the version 4.3 of the portfolio, complete with all of the version 5 updates that Sue has mentioned this morning, into the Onefile system. And that process came to an end pretty much on the 1st of September when the new standards launched from the HCPC. So we got to the end of the initial build phase on the 1st of September. As we were doing the build, we were consulting with our practice educators, we were consulting with colleagues that facilitate placements in HEIs, we were consulting with people that are involved in apprenticeships, so that we'd got a really broad perspective on how we needed to deliver Onefile to everybody. One of the things that came out very, very early on in September is that people would appreciate a more kind of structured rollout and a more structured launch. And so we'd literally just finished building Onefile on the 1st of September when we made the decision that actually we would be best delaying bringing people onto the platform until after Congress, because that gives us time to make sure that we've got these rollout resources prepared. It means that we've got the benefit of all of the additional questions and comments that people really, really helpfully gave us during Congress, so that we can make sure that as we do get people onto the platform, as we do start to roll it out, we've thought about as much as we possibly can. So that brings us to where we are now. We are now literally this afternoon going to start pressing the go live button. And I kind of want to reserve that privilege for myself, but I really want to give it to the team as well so that they're empowered to do that. So this afternoon, we are going to start making people live on the system. And that kind of internally to the Institute marks a transition from us doing the initial launch where we set it all up, we get it all ready to go. And we now actually move into what we're terming the embedding process. And that embedding phase initially will take us to Christmas. And the focus of the embedding that we're going to be doing then will be on things like making sure that people are uploaded into Onefile in a way that works for colleagues on the ground doing the training, but also is a sustainable process for colleagues working internally at the Institute as well. As Sue mentioned earlier, we are going to start the rollout of Onefile using the existing application forms that people are familiar with and have used for a number of years. But we are already aware from the workshop-y discussion, question and answer sessions that we've had at Congress that there are going to need to be some updates to that. And so the embedding phase that we're in now, that will take us through until September 2024, will pretty much follow the journey of people doing the portfolio, those early adopters, where we get feedback on the process of onboarding people into Onefile to see whether it works, make tweaks as appropriate. Then as people are on program doing the portfolio, somebody mentioned earlier about needing to potentially change members of the training team. Does the way that we've thought about that work practically on the ground, or do we need to rethink it? Do we need to look at it again? So over the next kind of 12 months, there are going to be periods of time where we do need to have, you know, some pretty frank discussions about who does what, where do they do it, how do they do it, and why. But hopefully that will mean that by September 24, we can move into the final phase of the Onefile rollout, where we start to enhance the platform and what the platform can do. So what I'm going to show you today is very much a surface level view of what the platform can do, but it is a ridiculously powerful system. And so what we need to do is get people to grips with using it in the first instance, build some experience in the workplace of people using it, and then get people's feedback to say, actually, I've seen a button that suggests it might do this. Can we try it? Can we test it? Can we have a look at how it works? And of course, we need to have discussions about that, because whilst certain features might work very, very well in one workplace, as the Institute, we've got to maintain that national overview and make sure that we're getting the best fit model that works for everybody, that gives the return on investment that's important for us. That enhancement phase will take us until September 2025, and that's the point at which the Onefile contract will renew. So fingers crossed, all being well, I'm very, very confident it will all go well. So fingers crossed everybody's happy with Onefile and we will be able to extend the contract longer term. If that's not the case, then we will have a set of data that is very metric driven so that we can take some really objective decisions about what does need to be happening next. I'm aware that people might have questions there about what happens if the Institute decides not to adopt Onefile long term. I think the key point to make now, just in the interest of time, is that if we do make that decision, nobody that has access to Onefile will lose access to Onefile. So the portfolios will be safe, they will be secure. They will sit in that digital space for as long as people need them. So nobody will lose access to anything if we do make a decision to move away from Onefile. I'm hoping that's not the case. We are starting to have discussions internally whether this 2-year period with Onefile for the Reg portfolio could serve as proof of concept for some of our other qualifications. And so there's quite a big piece of work that we might need to get involved with and certainly get some user feedback on in the next 12 to 18 months to see if everybody else thinks that there is that scope for expansion. One thing we're really keen on in terms of the digital offering of the Institute is that we keep the number of systems that people need to learn to use to a minimum to try and reduce that training burden, that need to learn different systems, because we know it adds a barrier to getting to grips with things. So that's where we are, that's where we're going. Let's start to dig in and have a little bit more of a look at Onefile. So I've got my laser pointer turned on just so that I can point to things on some of the later slides. But if we just have a look forwards, the reason that we've chosen Onefile is partly because of its information governance credentials. It's ISO 27001 accredited, so it is very, very stringently controlled in terms of information governance. ISO 27001 is one of the higher, more highly recognised information governance standards in the country, so it's fully GDPR compliant. The system is cloud-based and is very, very secure. The entire platform is backed up every 24 hours. And those cloud-based servers are held entirely in the UK. So all of the data that's retained on them does meet UK GDPR. For those people that are familiar with Onefile, you might have already heard that the UK-based company has recently been bought out and is now owned by a Canadian parent. That Canadian company have made a commitment that all of the data that's generated in the UK from the UK arm of the business will stay in the UK. So it's not going to be a case that data is moved overseas at some point in the future. The servers themselves are located in London. The disaster recovery servers are located in Cardiff. So everything is in the UK. The premise of Onefile is that it is designed to support every aspect of a tightly regulated GDPR compliant process. Onefile's first love, so where it kind of grew up from, is in providing an e-portfolio for apprenticeships. So all of the apprenticeship side of things, monitoring funding, monitoring student engagement, monitoring learning, monitoring assessment, all of those kind of things are baked into the system. What Onefile have done is they've built on top of that to give us the bespoke qualification of the Reg portfolio that we're now launching. It's also important to just mention that Onefile is tracking a whole load of metrics behind the scenes. It tracks so many things, it's unreal. One of the things that we're not entirely sure about yet is how much of what Onefile can track do people on the ground want it to track. What we don't want is for Onefile to be perceived as a big brother keeping a kind of punitive, watchful eye on people. But actually, if Onefile was a big brother that was keeping a more supportive eye on people and making sure that people don't drop the ball somewhere, then that's perhaps a much more useful way to harness those metrics that it gives us. I can see that there's a lot of colleagues in the room today and some people that are already involved in some of the other Health Education England qualifications, things like the HSST, STP programmes, PTP programmes. You might be already familiar with Onefile, in which case that's brilliant. If you are familiar with Onefile, we have tweaked the terminology we use a little bit from what HEE uses to more closely mirror the terminology that's been used in previous versions of the portfolio. But for those of you that are familiar with Onefile already, you'll know that everything's very icon based anyway. So follow the icon rather than the terminology we've used would be my advice there. Onefile's very deeply integrated with a lot of universities, with HEE, and for that reason, for those people that do have access to Onefile elsewhere, you are able to keychain all of your logins together. If you do use Onefile elsewhere, you will know what keychaining means. If you haven't yet used Onefile, you might not know what keychaining means. That's fine. I will give you an example in a minute of what that means, and you'll be able to see. As I've already said, we are using the next 2 years with Onefile for the Reg portfolio as a proof of concept for potential implementation of other IBMS qualifications. So feedback, evaluative comments from everybody on the ground will be very, very greatly received, both positive and negative. Okay, so the first thing we need to look at when we're looking at Onefile is that Onefile has a huge array of different user roles, user levels, user privileges. And some of the comments that were going into the chat during the question and answer and during Sue's presentation is probably worth picking up here. So we've tried to keep the terminology as similar as we can. So the student, the person completing the portfolio, will be known on Onefile as the candidate. Because there are people that will do little bits of ad hoc training that are not necessarily trainers per se, but may do some small pieces of training with candidates, we have retained the witness function within Onefile. Now, I know this is a contentious point and we can absolutely talk about it later if people want to. But the beauty of using a witness is that if somebody is literally just going to have one interaction with a candidate through their training journey, the witness does not need to be set up on Onefile as a specific user with their own username and password. If you do want to use witnesses, and it is an if, you don't have to, if you want to use witnesses, the process of putting all of the witness details in there is part of the candidate's responsibility. So the entire portfolio is very candidate driven, but the idea is that the candidate directs, okay, this is the witness that checked my understanding, determined that I'm competent on this particular point. The witness only has the ability to see and interact with pieces of evidence that the candidate specifically says, this witness can look at this piece of evidence. Okay, so the witness is very locked down in what they can and can't see. And what we're saying is that if you decide to use the witness role on the ground in your workplace, when the trainer ultimately signs off the portfolio at its completion, that trainer is also signing off that the witness was a competent person to make that determination. So the trainer is effectively vouching for the competence of that witness. Brings me nicely to the trainer role. So the trainer role, again, we've stuck with the terminology on the ground in the workplace, but that doesn't mean that the trainer role within Onefile isn't necessarily a trainer in the workplace. It could be that you have the main trainer of a particular candidate assigned this role, but it could also be that you have a training manager assigned as a trainer within Onefile to the same candidate. So To put that into context, we pay Onefile for the candidate's access to the platform. We can attach as many other people as necessary to that portfolio. So if you need 6 trainers plus a training officer plus a lab manager assigning to a candidate, we can absolutely do that. That's no problem at all. What you would have to do if they are all assigned as trainers, what you would have to do is reach a local agreement within your hospital, within your lab, whatever the setting may be, as to what that user hierarchy is. Do you really need all of those people to have trainer access? Or could it be that the laboratory manager just wants to be able to see the portfolio to just check that that candidate is on program and that they are progressing at a speed that is appropriate to everything else that's going on in your situation? In which case, does that person need to be on the platform as a trainer, or do they need to be on the platform as an observer? So an observer has a look but can't touch approach to what they see within Onefile. So the observer can see portfolios but can't necessarily go in there and fiddle or sign things off or tweak or change. The advantage of the observer role is that if you are on as an observer, not only can you see all of the candidates associated with your lab or your hospital or your trust or your network, whatever level we're working at, you can also see all of the trainers. And so an observer can see how many candidates, for example, are assigned to each trainer. Are all of those candidates accessing Onefile regularly? If, and again, it is a big if because it's entirely down to your local needs and wants, really. If you are using the features within Onefile to run progress meetings with your candidates, are all of your trainers holding regular progress meetings? As a lab manager, do you maybe need to step in and offer some additional training to one of your trainers because things are falling behind? Okay, so the observer has got a very, very powerful role in what they can see, but it is limited in the fact that they can't touch, they can't change any of the portfolio structure or evidence or that kind of thing. The last role that we've set up at the minute is the verifier role, and this is a role that I'll talk about more specifically later on in today's session. But the verifier role is something that we need some feedback from you. There are 2 or 3 ways that we could handle the whole process of final portfolio sign-off and verification. Onefile has got a specific way that it wants to do it that is not particularly good at mirroring what has been done historically. And so what we'd like to do, if we get time today, great. If we don't, we can follow it up at another time. But what we'd like to do is get feedback from people on the ground as to whether the suggestions and the process that we're thinking of for verification within Onefile is going to actually work, and whether that's something that you would want to see us roll out. So those are the roles, that's what's happening. What we've done, and anybody that was at Congress, you will have perhaps seen this graphic as part of a big A3 leaflet that we produced. And if anybody does want this leaflet, then if you drop me some details, I can get some posted out to you. What we've got is we've got a 3-stage process to getting through version 5 of the registration portfolio. We've designed it for efficiency. We've tried to design out a lot of the repetition that was there in previous versions. So in previous versions of the portfolio, for example, when you applied for it, you had to put your IBMS number, your HCPC number, and all of those kind of things into every application form you put in. Now, once you are on Onefile, then you are on Onefile. You don't need to provide us that information again. All we need to know are the details of the new candidates that need to be assigned to you, and we can just go in there and add them. And this brings me back to exactly what Sue was saying earlier, that we just need to see now how things work and then tweak that process for getting people on board, for, you know, what level of changes can different people make, and how does that roll out across the country. So at this stage, it will be the process of getting onto the portfolio will be initiated by the workplace using the same paper-based form as you are all familiar with. But over the next 2 to 3 months, please, please, please expect that form to change and be refined as we refine the information that we need and get more people on, and respond to your feedback. I guess the plea there really is, if you've got any previously downloaded versions of the application form, please keep going back to the website and just check whether we've updated them before you send a new one. That would be really good. What we will be doing as we do start to update paperwork, it will of course go on the Institute's website. It will go within the resources section that's built into Onefile, so you can access it directly from there. And we do have within Onefile the ability to push notifications and messages to specific user groups. So as we update the application form, we will be pushing notifications out through Onefile for those people that are already in it to see that we've updated the paperwork. But of course, if you're a little bit later than that, then you might just need to jump back across to the website. The key point is we're on a series of step changes. We're moving forward, but we're trying to do it slowly and incrementally and getting it right at every stage, rather than having to retrace our steps later to correct something that if we'd have been a little bit more careful, we could have perhaps foreseen. So stage one of the process is that labs will apply using the paperwork that everybody's familiar with. We will process that internally, but instead of candidates getting the PDF version of the portfolio or a Word copy of the portfolio, they will now be sent an enrolment link directly from Onefile. So instead of getting emails from us saying, here's your portfolio, the emails will come straight from Onefile servers. One of the things that we've experienced internally, and when I've been working with consultants getting the platform ready, they say is a common thing, is that those first couple of emails from Onefile nearly always go to people's spam folders. So what we've said here is that as we put people onto Onefile, we will email you from the Institute saying, expect an email to come through from Onefile. So please do check your spam filters. If you follow your email program's process for whitelisting Onefile's email addresses, you will get everything else then absolutely fine without a problem. So the enrolment forms, the enrolment paperwork, that's all going to be built into Onefile in the end. So all of that initial information that we collect from the candidate will be built into Onefile. The e-portfolio then will be confirmed and activated. And again, this is just a series of notifications. It sounds like a really arduous process, but it really isn't. It's just 2 or 3 emails that you'll get that just say your portfolio is now live. This is the candidate. These are the trainers and observers that are associated with that candidate. Crack on, happy days. So at this stage, we're now saying that a candidate is on programme, and we move forwards into kind of phase 2, or the middle stage of the portfolio. So just as previously, the most time consuming, the longest bit of the process is that process of collecting evidence, meeting with the candidate. If you want to use the progress meeting functionality within Onefile, you are more than welcome to do it. Everything within Onefile, again, just harking back to the data governance, everything that you put in Onefile is only visible to you as the trainer and any other trainers that are associated with that candidate, and those of us at the Institute that have the user permissions to access the portfolio. We've made the decision that initially, certainly during the rollout phase, me and Tom Mason, the education manager, will have full access to see everything within Onefile, but the education officers that will deal with the user administration and the user management do not have access to the portfolio itself. So the education officers can see all of the candidate details, the email address, the profile information, can see all of that kind of thing, but they cannot see what's actually inside the portfolio. It's something we can change later if necessary, but we just figured that that was a good place to start. The on-programme bit, where trainers train the candidates rotate around the disciplines, however that works in your laboratory, will continue to work exactly as it did before. The only difference, of course, is that we are evidencing the updated SOPs within this version of the portfolio. So Onefile is very much acting as the ring binder here. The candidate can put the evidence in either by directly typing it into boxes or attaching videos or audio clips or photos of, results or whatever it might be. They can put all of that straight in digitally. Or if you use written questions, you can get the candidate to write the answers in, scan it and upload it and attach it as a PDF. It's entirely up to you how you handle that process. One thing that Onefile does require is that as you are going through the process of training, it will not let you as a trainer sign off any evidence without putting some feedback in. Okay, so feedback on every piece of evidence is mandatory. Once all of the modules have been completed, any progress meetings you've held have been recorded within Onefile, any actions or tasks that have come from those meetings have been tracked through the system, maybe tracked back to specific SOPs, however it may be. Once everything is finished and all modules are completed, we hit the point of internal sign-off. And this is where the trainer or the training manager or the lab manager, however it works in your setting, will sign to say the portfolio is now complete. Now, at this point, historically, people would then apply to the Institute for portfolio verification. And initially, that process will be exactly the same. So the same paper application for verification form that you've sent in before is exactly how we will start the process with Onefile. What we are doing as we get those first few forms in where people are saying we're now ready for verification and for a verifier to be assigned, is we are tracking the metrics in Onefile to just see whether the metrics in Onefile as they sit can totally replace the application for verification form. So it may be that within the medium to longer term, so within the next 12 to 18 months, it might be that the application for verification becomes an automated process. Again, we'll consult and we'll talk to people before we do it, but the system is very much capable of doing it if we want it to. At that point, we will assign a verifier. And the process then, once the verifier has been assigned to the portfolio, again, is exactly as the process is currently. The verifier, the lab, the candidate agree on the verification date and time, whether that verification is virtual or face-to-face, and then the verification will happen. Onefile integrates natively with Microsoft Teams, so you can do virtual verifications through Teams, no problem whatsoever with Onefile. But again, it's just as competent at handling face-to-face verifications. The only thing that the lab would need to ensure is that on the day of the verification, the verifier has access to a computer. However that is facilitated, that's the only thing that is required. As far as computer access is concerned, you only need to be able to access a web browser. A lot of the consultancy work that has been done with us during the development phase of Onefile is with people who have rolled out Onefile within the NHS already. And so they're able to tell us that even the NHS IT system using Edge instead of Chrome can handle Onefile with no problems whatsoever. One thing I will say right now before I forget is that if you have got tech savvy candidates who like an app for everything on the phone or tablet, please try and tell them to avoid using the Onefile app, because it's okay, but it's not as good as the web-based platform. Okay, so if you do have really tech savvy people in your teams, please try and dissuade them from using the app because it's not quite there yet. The key point at this stage is do not let any little bump in the road stop you collecting evidence. The training that people are doing on the ground is not different. It's just the way that we're collecting that training together to evidence it at verification. So when we get to the verification process, it is exactly the same as the current process, except instead of having a massive PDF or access to a OneDrive folder or something like that, everything is stored within Onefile. All of the SOPs are mapped to the pieces of evidence so that you can see where everything connects and joins together. From the verifier point of view, Onefile makes the assumption that the candidate will, when you tick the final box at the end, it will pass the portfolio. So what that means is if there's something that you think has not been evidenced, you need to untick boxes. So you're not having to tick a million boxes saying, yes, all 129 of these SOPs have been hit. It would be a case of you unticking the ones that you don't think have been hit. So the idea is that it streamlines that process and it makes it really easy for you to see where you are and what the candidate needs to do. The verification side of things, you are able as a verifier to provide feedback both to the candidate and the trainers and the laboratory. You can send feedback. Vicky Moyes, I know you're in the room and I've got an answer to this question now that I didn't have at Congress. As a verifier, you are able to feedback to the candidate, and anything that you feedback to the candidate is visible to the trainer. As a verifier, you are also able to feedback to the trainer without the candidate being able to see that. So you do have that private channel of communication to the trainer if you feel that you need it. It's something that people would say, or were saying, would be useful, particularly for virtual verifications. Again, the Verifier report form, the laboratory feedback form, they will start live within Onefile as exactly the same kind of forms that they are now. Some of the discussion I would like to have today, if we get time, is to get some feedback on how people think that might need to change and whether people would like it all to be built into Onefile. Okay, so the kind of upshot for where we are now is that very little on the ground has changed. It's a different tool to record the training. It's a different tool to store the evidence, but the training that's actually delivered isn't any different at all, with the exception of hitting the new SOPs. Candidates will still need the same support, the same guidance, the same kind of pastoral care that they've always needed. The beauty of Onefile is that you are able to evidence where that pastoral support has been offered if you want to do that, and you are able to track any actions, targets, goals that come out of that support and that guidance that you are giving. It is a new system, it is a different platform, but if we think back to when we all got our first mobile phone, or we first had to learn how to use that new Sky TV remote or anything like that, we will get there in the end. It will just take a bit of practice and a bit of trial and error. You cannot break Onefile, so please don't worry about that. If we compare the paper versus the digital portfolio, if you think about the key issues of any portfolio-based qualification, hopefully you will be able to see how a digital portfolio is better than the paper-based version. From a security point of view, the paper-based version needed locking away, whereas the digital version is controlled by username and passwords. The thing is, if the portfolio is locked in a filing cabinet in the lab manager's office or something like that, you can't necessarily access it when it's needed. But of course, with a digital portfolio, as long as you have got access to a digital interface, a web-enabled device, you can access it from anywhere. Accessibility within portfolios can be challenging, particularly for candidates with dyslexia or visual impairments, where they maybe need coloured overlays or they need bigger fonts, that kind of thing. Onefile can handle it natively. Click a button and it will change the colour scheme. Click another button, it will change the font size or the font type. Okay, so it's really accessible in that context. We haven't really seen the portfolio platform yet, but you will see how easy it is to track progress. It can be monitored in real time. You don't need to filter through a portfolio to see, have they completed this evidence? You can see at the click of a button on a screen whether evidence has been completed, whether it's been completed by the date that you've asked them to complete it by, and so on and so forth. The candidate can manage the portfolio in a way that they couldn't manage it previously. Presented with the paper-based portfolio and all of the evidential requirements, it very much needed guidance from the trainer to say, right, we're hitting this piece of evidence. Predominantly because you as trainers are much more familiar with the portfolio structure, and kind of organisation than your candidates. Whereas now, what you can do as trainers is you can literally, at a few clicks of a button, you can organise the priority of the portfolio for the candidate. So you can say to them, here's module 1, I want that completing in 3 months. Here's module 2, I want that doing by Christmas 2024, whatever it might be. So you can assign tasks in order of priority from that mess, if you will, of the entire portfolio. It's easy to track compliance. You cannot progress through the stages of the portfolio until the required sign-offs have been achieved. So you cannot progress to verification until all of the modules have been signed off by a trainer. You cannot sign off a module as a trainer until all of the SOPs within that module have been hit. And Onefile is tracking all of that automatically. So you don't need to go and look anywhere to see whether a candidate has hit all of the SOPs within a module. If the system is letting you sign it off, it's only letting you do that because the candidate has completed everything and everything is tied together. The other thing that goes with the compliance and the completion tracking is that Onefile has full gap analysis built in. So if it's not letting you sign off a module, you can literally go in and click one button and it will show you which SOPs have not been evidenced and therefore which SOPs are stopping you from being able to sign off a module with a candidate. So it can do all of that administration and that heavy lifting on your behalf. As far as verification is concerned, this is the process that hopefully will be made much easier. It'll be much more rigorous and it's certainly much more quality driven in terms of audit trails and that kind of thing. In the context that we're not moving physical portfolios anywhere now, sending them by post halfway across the country, it can be accessed anywhere with an internet connection. And of course, there's a date and a timestamp associated with the user that accessed the portfolio at that particular time, what that user looked at, how long, if we wanted to. I mean, I'm not suggesting we do, but we can even track how long people are looking at different bits of evidence or resources for, should we so choose. So that's why we think the digital approach is better than the paper-based version. Hopefully, what you've seen so far and heard so far is that it should provide a time-saving step forward in how we administer the portfolio. If you compare the paper-based portfolio, by the time you've found the portfolio, located the work that needs marking or assessing or some kind of interaction from you as a trainer, actually marked and fed back on the work, mapped it against the SOPs, within 15 minutes, we reckon, based on kind of my quick back of a packet type calculations, that there's actually about 7 minutes of useful time there input onto the candidate's portfolio. If we compare that with the digital based system, as long as you sat at a computer, ideally with a cup of tea, a minute or so to log in, a minute to locate the task, because as you'll see in a few minutes time, it's presented on a dashboard for you, minute to locate the task. That then gives you effectively 13 minutes to mark and feed back the work that's within Onefile. So we reckon that in that same 15-minute window, you would get 13 minutes of useful time doing something constructive on the candidate's portfolio. Okay, so going back to that roles access into Onefile, we'll start by having a quick look at Onefile from the perspective of a candidate. What does the candidate see when they go into Onefile? Well, like I've said, Onefile is cloud-based, and so you would access Onefile from onefile.co.uk. It is not accessed through the Institute's website. Okay, so it's accessed directly through Onefile. This is the standard Onefile login screen. Username and password for a candidate, we are recommending that they use a personal email address, not a work email address. And the reason that we're recommending that is for that perpetuity of access after they've perhaps left the hospital or the lab or the university or wherever it might be that they are right now. it's likely that those professional email addresses will be shut down, whereas people tend to keep their personal email addresses for a much longer period of time. So we're recommending for the candidates that when they sign up for the portfolio, they use their personal email address. One of the things that the education team have been doing over the last week, as they've been raking through the applications that have already come in, is that for candidates that didn't give us a personal email address when the application came in, we've gone back to them. We've suggested they give us a personal email address. We've not mandated it, but we've suggested they do. We've explained why we think it would be a good idea for them to give us a personal email address, and we're awaiting the response for some of those. It's no problem if people do want to keep their work email addresses, except that if they do leave the NHS and the lab that they're working in, and their email account is shut down, if they do ever forget their password, they wouldn't be able to get back into Onefile, and so it might cause them some problems down the line. Once they have signed up with their personal email address as the first email address on the list, they can then add in other ones as well. Okay, so it's not just one email address they provide. They can, if they want, also provide their work email address so that they don't miss anything if they don't check the personal email address very often. So that's what we would recommend for candidates. Once you've logged in, or once the candidate has logged in through this initial screen, they're presented with a dashboard of activities, of tasks. So what you can see here is that the tasks and messages tab here is highlighted in yellow. It's highlighted in yellow just for me because that's the colour that my eyes will go straight to it as soon as I log in. It's highlighted in yellow because there's something new for the candidate to do there. So you can see that this candidate has got 13 tasks to complete and 7 unread messages. If there is nothing to do, in inverted commas, there's no highlighting. So literally you can use your eyes and just follow the highlights and it will tell you what you need to do. It confirms the qualification that the candidate's doing. It tracks their overall progress against all of the SOPs that are being completed. If you as trainers have set deadlines for evidence or SOPs to be hit, or if you've put in progress meetings into the system, the calendar here will show what's structured over the next week or month, or however you choose to set it up with the candidates that you're working with. So you've got a really visual way of seeing what's coming. One of the questions that I was asked at Congress that I'm still waiting for Onefile to come back to me on is, can this calendar integrate with Outlook? I don't know the answer to that definitively yet. I would suspect it possibly can, because you can log in, you can attach your Microsoft credentials to Onefile if you want to. So I would imagine that if you want calendar integration, you probably do have to attach any Microsoft login credentials that you might have to your Onefile account. But as soon as I get back any information from Onefile, I'll update people there. The tasks due just tells the candidate what's coming, what do they need to do. It's a different representation of the calendar view. And from here, the candidate has got access to any assessments. If you want them to track the time that they're spending completing bits of training or bits of evidence, you can get them to log timesheets of how long it's taken them to do things. You can get them to complete a learning journal, which is designed to be a very reflective piece of it. Effectively, it's like skills tracking over a longer period of time. It is something that we can tie in with the scorecard feature. At the moment, we've not developed these two tabs within Onefile. It's something that we'd like to get feedback on. The scorecard effectively allows candidates to do skill scans at various stages through the training and then provide reflective commentaries on how they feel they are developing as a candidate, as an individual. The features are there, they can be implemented. We've just chosen not to start with that because we'd like to get everybody on board and working through things first. The courses tab, again, it's not something we're developing in the short term. It is something that can be developed on a trust by trust basis and is effectively the same as a university's virtual learning environment. So any candidates that have used things like Moodle or Blackboard or those kind of platforms, the courses tab is Onefile's equivalent of that. Messages, as suggested, any messages that have come through, progress tracking through the portfolio. The resources section is where we will put paperwork, a link to the Institute's homepage, and a help centre. This help centre is a more fully fledged and detailed help centre that's provided by Onefile with loads of guides and user documentation that is only available to people that actually have a Onefile login. So if you were to go and look through the Onefile help pages on their external website, the information that you can find is not as detailed as the information that you would find by clicking on this help button here. Within the main window, access to the portfolio, so you can see here what the portfolio looks like. You get a breakdown of various other screens that I'll show you in just a second. You can upload evidence directly. So the idea of this button is that if there's evidence that just needs to be stored on the system and the candidate's going to come back to it later and maybe map some SOPs to it before they send it off to the trainer to be signed off, it literally just provides that easy dumping ground to get evidence onto the platform so that they can then come back to it and maybe think about it later as they finish a reflective statement around it or whatever the situation might be. The resources section is where we as the Institute will put information in to help guide and support people. Every user role within Onefile has access to the resources. The way that we've implemented this is that candidates can only see the resources available for candidates. Trainers can see the resources available for trainers and candidates. Verifiers can see the resources available for verifiers, trainers and candidates. So we've got that kind of tiered approach to the support that we're providing. Okay, if you were to click on either the portfolio or at this stage the tasks button, what you would see is a screen a bit like this. So we've got the date that evidence is put into the platform. There is a unique reference number that's assigned by Onefile to that piece of evidence, and these buttons are clickable, and so if you clicked on any of these, it would take you directly through to that piece of evidence. It tells us what that piece of evidence is, so you can see that for each module, section 1, module 4, the mandatory evidence within Onefile for the reg portfolio will always be given a code MER, mandatory evidence for reg, and then a number to just stipulate the number of was that the 3rd, the 5th, the 9th piece of evidence of that type that went in. Candidate choice evidence, which sounds a bit like I don't know, an old tobacco brand maybe. Candidate choice evidence goes in with the code CCR, so you can see at a glance whether it's mandatory or candidate choice evidence. You can see which module it's associated with. The evidence method here just tells you that it was candidate choice or mandatory. If you've got timesheets and completion tracking switched on and you're using that, it will show here how long the trainer spent looking at it. It is self-report, so the system isn't timing you. It is a self-report measure, so if you are tracking time, you would just be expected to put a number in the box to say I spent 9 minutes looking at this or whatever it might be. Similarly for the candidate, it's not any kind of proctoring in that respect. It literally is just a self-report of it took me 20 minutes to write this or whatever. The training plan here initially will be set to none. What this will do ultimately is it allows Onefile to track completion of multiple qualifications at the same time. That's way, way, way ahead of where we are now. So initially that will just say none for everybody because we're not working towards any particular training plan. One of the tweaks that we're making as we get people on board is that this might change from saying none to just Reg Portfolio version 5. Okay, whatever it says, it will always say the same thing. The last column here is a really, really useful one, because what this is showing is who is currently blocking the progression of sign off for this piece of evidence. So what this is telling me is that the evidence is currently sat with the candidate. So what we can get from here is that the evidence is uploaded because it's got its reference number, but because it's sat with action required by the candidate, it means that either the candidate has not yet submitted it to the trainer to be signed off, or the trainer's signed it off and has sent it back to the candidate for more work to be done. Okay, so you can see at a glance what's sitting with who. As I've said, candidates can use witness statements. Bizarrely, the term witness is the only term within the portfolio that we can't change to be something of our own choice. So we're aware that the use of witnesses is a bit contentious. As I said earlier, if you choose to use witnesses, trainers will have the final sign-off to vouch for the competence of the witness being able to sign off what they've done. So what we're saying is, if you're going to use witnesses, that's okay, but use them with caution and just be careful that the ethos of meeting the SOPs is met. If you were to look at progress of a candidate, you can see here against every module what the progress is. So the red bar is the anticipated progress by the system. Okay, you can set that up as trainers. If you are saying that you want your candidates to move through the portfolio in 12 months, then you can set that for each candidate individually. You can then say, actually, within that 12-month window, I want section 1 module 1 completed in the first 3 months. I want section 1 module 2 completed in months 3 to 6. So you might want to step the delivery of the modules like that. In which case, this completion tracking, the red bar on here, will adjust itself to fit the deadlines and the dates that you're putting into the system. Again, if you don't want to use the system like that, that's absolutely fine. All you will need to do is just make sure that you tell your candidates to just ignore the red bar, because it will automatically track the portfolio, assuming that it will take you up to 3 years to complete. Okay, so if you don't want to set your own completion tracking profiles, that's absolutely fine. Just tell your candidates to ignore the red bars. The green bar shows the actual completion through the module, and you can see that shown here at the side. When modules have been completed but not yet submitted to a trainer for sign off, so as a trainer you would sign off each piece of evidence. Once the module is completed, the candidate would then say, okay, you've already signed off the 3 pieces of evidence, but now will you sign off the whole module? So section 2 module 3 is at that stage. The candidate has not yet said to the trainer, sign it off. When the candidate says sign it off, the word candidate will appear here. When the trainer then goes in and signs off that module, trainer will appear here. When the verifier has been in right at the end of the process and verified that module, verifier will appear here. So you can see that these modules have been signed off by all 3 people. This module has not been signed off by anybody yet. So you can see very much at a glance who's signed off what still needs to be completed, what still needs to be signed off. The GLH column here, that's just guided learning hours. It's a very apprenticeship focused box that really, if you are setting a number of hours that you want a candidate to spend against each module, you can set that, but it's not a feature that we thought most people would use on the ground. So that's what the candidates and the witnesses, if they were within Onefile, would see. If you are in there as a trainer, your initial login is exactly the same. Okay, so exactly the same through the Onefile portfolio. The difference is, once you log in as the trainer, you will then be presented with a list of all of the access that you have with the different roles. And for those that are new to Onefile, this is what's known as key chaining. So what you've actually got, I'm just going to go back a slide, what you've actually got is a 2-step sign-in process. So you sign in with you as the individual, and then you say to Onefile, okay, today I'm going in as an assessor or a trainer, or today I'm going in as a verifier, or today I'm going in as centre manager. What this does is it means that the list of candidates that Onefile will present to you will be appropriate to the role that you are in the platform as right now. So it may be that you are both a trainer and a verifier. But what Onefile needs to make sure is that if you are verifying something, you are signing it off as a verifier. But if you are acting as a trainer, you are signing it off as a trainer. And this is how Onefile achieves that. So if you are going in to train somebody, you would click on your, we changed it from assessor now to trainer. So you would click on your trainer account and go in as a trainer. That means that the functionality that's available to you, the candidates that you can see, are the ones that you should be able to see in that role. And therefore it minimises the likelihood of you making a mistake in terms of clicking something for verification when you actually meant to do it as in the context as a trainer. This keychain is automatically enabled for everybody. So as long as you give us the same email address that you are perhaps using elsewhere with Onefile, or you are using with different user levels within our implementation, as long as you give us the same email address, everything will tie together. Okay, so you will see it all in one place. At a glance, you can see here whether you've got any tasks to do as that particular user and whether there's any messages that are waiting to be read. Okay, so you can see at a glance what needs your attention. Once you've logged in as a trainer, again, it's very dashboard driven, so you can see any calendar events that are necessary. If you've got progress meetings, if you've got work that's come in from a candidate that you need to mark, if there are any candidates due to complete. So if you have enabled completion tracking, if you want them to complete within 12 months, 18 months, whatever, you can see who's due to complete in the next 90 days. You can see when your candidates last logged in and whether they're on target, whether there's any candidate that's overdue anything, whether you've got any progress reviews outstanding, and whether there are any tasks that you as a trainer need to do. So you've got this very, very much at a glance dashboard driven approach. If you scroll down the screen from there, you will then see a list of any candidates that you are associated with, complete with the qualification that they're on. Again, this will just say Reg at the moment. Any progress, so actual versus target progress, if you are using that. Anticipated completion dates. This is good because you can enable it so that if they're working through things quicker, it will start to shorten that completion date. So it's kind of trying to predict what's going to happen next. Again, you don't have to use it if you don't want to. You can see whether there's a target deviation. So are they ahead of where they should be? Are they behind where they should be? So you can see here that Gail's 11% ahead of where the platform thinks she should be based on the dates that you've put in, or Jim, well, part of the course with me, behind the curve. Any progress review meetings, they're all listed. Any modules that are already signed off are shown, and any outstanding tasks that are still sitting with that candidate to complete are shown. What you can do from here is you can look at any outstanding assessments that you set them. So just a click of a button. If you've planned any particular pathways through the portfolio, so if you've planned a way through that they're going to do module 3, then module 5 of section 1, then they're going to do a bit of section 2 somewhere else. If you've got all of that set up, then you can access those bespoke plans from here. And if you want to do a gap analysis, it's as simple as clicking a button to see which SOPs for Gail are still outstanding at this point in time. You can filter your candidates. You can search for them directly by name. Show my candidates only. At the minute, we'll do nothing. We do have the option, and again, it's something that we'll consult with people on as we roll out the platform more fully. We do have the ability to devolve control a little bit so that candidates can see the details of any trainer that they work with in their workplace. So it might be that the candidate chooses which trainer to send a piece of evidence to, rather than it all going to the same trainer automatically. All of that is stuff that we need to talk to people about and embed as we go forward. Again, you've got this target tracking. If you want to upload any files, if you've just written a new bank of questions, you can upload that and just store it on here until you decide to deploy it with your candidates until later. If you've marked a piece of work and you need to just send it to your candidate through here, you can absolutely upload that and it's ready to go from here. So again, it's a bit of a file repository, I think is a good way to describe that. When it comes to signing things off, as I've said before, everything is already signed, dated, time-stamped by the system. So your physical signature and date is now replaced by a tick in a box and a save and quit. The system has highlighted it in yellow. Okay, so the system is saying this is where you, as the training manager or the trainer or whatever it is, this is where you need to sign. You can see that the candidate signed and dated it on this time and date, so you can see where things are in that completion journey. Excuse me, and you can see who else needs to sign this off. We're still working through the verifier process a little bit. Again, if we get time today, talking about that is something that we could do together, but if not, we don't. Save and quit will accept that piece of evidence. It will accept that module. It will mark it as completed. If you're not happy with it, you still need to sign to say that you're not happy with it. But instead of clicking save and quit, you would just click resubmit. Resubmit will send it back to the candidate, complete with any feedback you've given, saying, actually, there's still more work to be done here. Okay, and that takes us to where I said I'd get to in the first part of the session today. I'm aware that we are running behind time, so I'll stop sharing my screen now. Hopefully people found that useful. Any questions at this stage?
Thank you, Jim. I'm just looking at what time we're on and what we still need to get through before the end of the session. And there are quite a lot of questions and comments in the chat. Yeah. A couple of people have just put their hands up. So I wonder if we do 2 quick questions before we break, have a comfort break so people can stretch their legs, go and get a drink, go to the toilet, whatever they need to do, and then come back in. So do you want to do the questions where people have got their hands up and then you and I can go back through the chat? I've tried to answer things as they've come up. So I've gone into people. The first person up is Panitha.
Oh, cheers, Sue, thanks.
Oh, hi. Hello.
Hi.
Hi.
Just wanted to ask, hiya. Thank you. That's quite a detailed, lovely, explanations. When you said about, the digital platform actually recognizes the SOP, does it, in the paper format, we usually, across the line, we mark what standard it relates to. So does it automatically recognizes the SOP, or do they need to just put it within brackets when they collect the evidence?
Good question. So what happens when the candidate puts the evidence into Onefile, they will either type it directly into the boxes or they will scan and attach the evidence, whatever the situation is that works best for you. Once they've done that, they are presented with a list of the SOPs that we've mapped to that module. So all the candidate needs to do is just tick the relevant ones to say, I think this piece of evidence maps to these SOPs.
Okay, thank you.
Next is Tracy.
Hiya, so yeah, just a couple of questions. Can you have more than one verifier, and can you have more than one profile for the same person at any one time?
Yes, you can. You absolutely can. The 2 bits of that question are going to be answered differently. So yes, you can have more than one verifier. Okay. The roles that I've shown you so far within Onefile are selected from a great long list of other profiles that are available. So for example, if you wanted to have a trainee verifier and a verifier, so if we were buddying a new verifier, for example, with a more experienced one, the system's got the capacity for that built into it. If there's 2 verifiers, absolutely, we can attach both of those. The thing that would need the discussion there is both of those verifiers, if it was 2 verifiers, would have the same level of sign-off.
Yeah.
The way that Onefile is set up, it would accept sign-off from either of them. Yeah. It wouldn't have to be both.
Yeah,
so there just need to be the discussions on the ground as to how you would manage that and what that process would be.
But you could be a trainer, you could have a trainer role and the verifier role, so you could sign both.
Absolutely, yeah, absolutely, you could. That's no problem at all. And if you want them all to be keychained together, like I showed on that screenshot, just make sure you give us the same email address. If you don't want them to be keychained together, if you do want to have to log in with separate usernames and passwords all the time, tell us, because we can turn that off. But yeah, we thought that'd be something that would make life easier.
No, definitely. Because I've got seven trainees going through right now. So yeah,
absolutely, yeah. We'll just keychain it all together for you, no problem. And then you will see it all as one big dashboard, so you will see everything in one place. Yeah.
Okay, perfect, cool. Thank you.
Lovely. Claire is next.
The first one is, how do we request to be an observer? So I'm education lead for the whole of pathology, so I'd like to just be able to see how they're progressing. So that's my first question. And the second one is there a possibility or an intention that you might assign a verifier right at the start, so that a verifier could go in and verify modules, you know, throughout the year, as it were, so that it wasn't all done in one time?
So
Claire,
the first question is easy.
Sorry.
I just understand. The first question, you just need to make sure whoever's applying for the portfolio puts you down as an observer. That one is really easy. Somebody asked a question in the chat, Jim, that you won't have seen about partial verifications for university students. That is possible. We just need to know that that's a setup. For most people, they do everything, upload everything, and then they ask to be verified. Some people may do it a different way, but we just need to know that. We have to put the verifiers on. We have to attach them ourselves, and we have to check that they're appropriate. So we devolved that responsibility to our integrated programs before, but they can still tell us who they would like to use. We just need to do that double check. They've not had any involvement in the training. So it's possible to add at any point, isn't it, Jim? We just need to know what it is that you want us to do.
Okay, thank you. I'm going back to the observer. If like microbiology asked me to be an observer, would then I be able to see hematology, cytology, that sort of thing as well? Okay, fab. Thank you.
So as long as you're attached to that person's portfolio, so when they apply, they say, this is the candidate, this is the training officer, this is the person who needs to observe, then we can attach you to as many as you want to be attached to.
Oh, I see now. So they attach me every time. Lovely. Thank you.
One of the pitfalls that we've identified as being a potential stumbling block for us that we're going to just need to be very careful about as we roll out Onefile is that if you're an observer, let's say, I mean, my local hospital here is Airedale. So let's say you were an observer associated with Airedale Hospital as a workplace. As an observer for that workplace, you would be able to see every candidate and trainer that works within that workplace. So you would have that kind of top level oversight of everybody that's in there as an observer. You wouldn't be able to see outside of that hospital, but anybody that's associated with that workplace, you would be able to see what they're doing.
So for a training manager, that's the kind of access that we think for somebody you might just want to see.
The kind of role that you described, it seems as though that's the kind of access you were asking about, really.
Yeah.
Training manager, placement tutor, they're the kind of people that we thought might have that global view.
So as soon as they ask me to be an observer, I'll automatically be able to see everyone at the hospital.
As you're attached,
Brilliant. Thank you.
There's 4 more questions. I'm keeping an eye on the clock. Otherwise, we're going to be a bit tight on time for 1 o'clock. So Julie is next.
Sorry, it took me a while to unmute there. Thank you. Very interesting presentation. 2 questions.
Yeah.
The first one was, if you had 2 email addresses, so if you were working both as a university lecturer and you were associated with placement students for that, but you were also a training officer within the NHS, would you have to sort of not keychain them and go in individually, or would there be a way of attaching both and keychaining them?
It's entirely up to you. We can do either. You can either keychain it against one of the email addresses, not keychain it at all, or have them both registered, again, with or without the keychain. So any permutation of that is possible. One thing I did mean to say is that whilst we're recommending that candidates use their personal email addresses, we're recommending that trainers, verifiers, observers, anybody else uses a professional email address. Just because from experience, candidates do work at night and in the evenings and that kind of thing. And what you don't want to happen as trainers is your personal email address pinging all night saying that you've got notifications, things that you need signing off and that kind of thing. So keep it professional as a trainer or a verifier or an observer.
And you can just choose the profile. That's the thing, isn't it, Jim?
The other thing to be said there is when you get your login to Onefile, follow the guidance that we're going to put on our website again today about setting up your email preferences, because you can set how frequently you want Onefile to update you with things that you need to do. So you can get it to ping you an email as soon as somebody submitted something, or you can get it to just email you maybe once a day or twice a week or whatever it is. So please do make most of that function, so that you're not constantly being bombarded with updates for Onefile.
Thank you. The other question I had was, I just noticed on the penultimate slide that you shared, there was both verifier and external verifier, and what was the difference between those?
Yeah, absolutely. So at the moment on the ground, there is no difference. What Onefile actually wants to do is, once each module has been completed by the candidate and signed off by the trainer, what it actually wants to do is send it straight out to an assessor, because that's how apprenticeships and BTECs and that kind of thing are structured. The problems that we're having is trying to stop Onefile do that, and the solution and the workaround I'm going to ask people about later is a workaround to that problem of wanting to drip feed the portfolio to the verifier. So that's why those two roles were shown, because at the time that screenshot was taken, we were just working on the workaround and what it would look like. The verifier and external verifier, they were Onefile's default terminology, and if we implement those two different roles, we would probably rename them to be something that's more appropriate to what happens currently on the ground.
Okay, we've got 3 more questions. Next one is, I'm just trying to find the name. Alison.
Hi, Jim. I've
Hi,
got
Alison.
2 quick questions.
Yeah.
So are there file size limits on what we can upload to Onefile?
Yeah, good question. At the minute, it's 100 megabytes, which does mean that it sadly, it precludes videos, particularly from an iPhone, because iPhone videos are massive. So try and encourage your candidates to use other evidence types. But yeah, 100 megs per piece of evidence.
Okay. And when you're mapping to the standards, are you able to map to them more than once, or once you click it for one piece of evidence, will that standard disappear for future pieces?
Okay, good question. So the answer is it can do either. We've set it at the minute so that once it's been mapped once, it won't disappear off the list. So you can map it multiple times if you want. Onefile has got a full set of completion tracking rules behind the scenes. So all it is expecting at the moment for each module is one piece of evidence listed as ME, mandatory evidence, 2 pieces of evidence listed as CC, candidate's choice, and across those pieces of evidence, the SOPs that we've associated with the mandatory evidence must be shown in that piece of mandatory evidence. The SOPs that we've mapped to the other 2 pieces of evidence can be shown anywhere in that module.
Okay.
Does that make sense? That makes sense in my head, but I'm aware of what it looks like. So
no, that's great. Thank you.
Yeah, cool.
Lovely. Sonia?
Coming back to the question about an observer, because at MFT in Manchester, we're a huge trust. We've got a team of training managers for the different departments. So like, can a training manager as an observer be like, can it be narrowed to like your departments?
Yeah, absolutely. And it may be when one of the things that happened to me at Congress, which was really useful, is the kind of discussions on you that you just said there, where big networks need oversight. So one of the things I'd like to do as we embed Onefile is look at what those oversight roles need to be. Do we need to bring in some of the other user profiles that we've not mentioned kind of publicly yet that Onefile has got in it to facilitate greater access and flexibility with those bigger groups?